And good afternoon, everyone. I'm Tania Rogers, and it is October already, and October is Breast Cancer Awareness Month. Some of you might have some questions, some of you may have comments, some of you may be diagnosed with breast cancer, or have a friend or someone. We can all think of someone in our lives who's been affected. I know personally for me, I have lost a friend to breast cancer, but others who have battled it and are survivors, not once, but sometimes twice. So today we're going to have some special guests with us today. One of the guests is Nancy Brinker. She has the Promise Fund of Florida. And as you know, she is Susan G. Komen's sister. So welcome today. Thank you for joining us.
Thank you very much, Tania.
And also we have Dr. Julian Berrocal, breast surgeon, women's health and healing of the Palm Beaches. Thank you for joining us today.
Hey, thanks for having us.
And then we also want to welcome Dr. Dianne Georgian-Smith, breast imaging, JFK Medical Center and Palms West. Thank you so much also for joining us today.
Thank you.
So let's start out. If I could start out just very briefly with Nancy Brinker. Nancy, everybody knows Susan G. Komen. We've heard that name for decades. If you could just kind of briefly tell us about how it all started for you, because you started really raising awareness about breast cancer because of your sister.
It's true. And actually, Tania, it started with me almost 50 years ago. I was just getting out of college, and President Nixon had declared the war on cancer. And I thought it was the most exciting, ambitious thing I had ever heard. And so then, little did I know that just 10 years later or 8 years later, my beloved sister would be dying of breast cancer. And in the day, she was, unfortunately, there were very few trials to treat patients at her age. She was 33. And, she didn't do well on anything. And eventually we got her to MD Anderson, and we learned so much there. It was one of the few breast centers in America at the time. And in fact, it's what drove me to answer the second part of the promise I made to her. The first part of the promise was that I would work as hard as I could to find a cure for this disease. But the second part was, as we saw the many lower resource patients from all over the world come to be treated there, many of them would be sitting on the floor down the hallways. And she looked at me one day and she said, where a woman lives shouldn't matter whether she lives. And that stuck with me all these years. And so right now we have such a dire problem in Palm Beach County. 85,000 women with no screening, no access to care, and no insurance, and they need to be helped, and they need to be screened, both for breast and cervical cancer. We have now opened a screening center at Found Care, one of our federally qualified healthcare centers. And since that time, last January when we opened it, along with 7 partners in the community who are doing the same thing, we've already screened, navigated, educated, and in some cases found treatment for 10,000 of those women. So we're working very hard to get through all of them as fast as we can, but we're largely dominated by for-profit centers and hospitals. So there are challenges and barriers, but barriers are just to be climbed over.
Now, something this week that people are talking about is Governor Ron DeSantis' wife, Casey DeSantis, and how he shared that she's been diagnosed with breast cancer at 41. I know I've done several stories on people where they were pretty young, but I always feel like when I hear it in the 40s, it always seems for a moment, it takes my breath away. Like, and you look at her young kids and you think, oh my goodness. So if you could just briefly comment on that, and then I'll also.
Well, I can, and from personal experience, Casey is just a lovely young woman. Unfortunately, I know exactly how she feels, because 3 years after my sister died, I was diagnosed. I was 37. And it is frightening enough when we know so much more today. But it is a very frightening thing, because you say, will I live a normal life? Can I raise my family and children? And I know she's probably had all that go through her mind. And we all wish her so well. And it just demonstrates how anyone can develop this disease. You're not protected because you are well known or because you have access or anything else. But hopefully she will have very good care. I'm sure she will, and she'll be fine and hopefully get through this.
So I wanted to hear from Dr. Julian Berrocal. What comments do you want to share, especially hearing about the First Lady?
Yeah, it's very sad news to hear about that story. Definitely early detection is the key. We really want and promote that women get their 3D screening mammogram on an annual basis. Starting at the age of 40, we encourage that they meet with their physician to find out, are they dense breasted, which we know can increase the risk and also can alter how we screen that particular patient. Also, in discussing with their primary care physician, their gynecologist, they can determine their lifetime risk of developing breast cancer. And those three factors really play a role in how to best screen that patient. Again, with early detection, patients are diagnosed at a very early stage, and we know that patients diagnosed early do very, very well.
So if you could explain, and I'll have Dr. Georgian-Smith jump in as well, explain the 3D, because is there not a regular mammogram and then there's a 3D? Because people may not even know what to even ask for.
Right. So, so it's part of mammography. It's a function of the mammography machine that take just a two-dimensional picture. Then there's an additional portion in which the machine will partially rotate around the breast. And what that does is it clarifies particular slices through the breast so that we can see things that are otherwise obscured on a 2D mammogram. So we know from lots of studies that we're clearly finding more invasive cancers when patients get both the 2D with the 3D mammogram. So it is tremendously helpful to increase the sensitivity of mammographic detection, but it's also helped to reduce the false positives. So a lot of women are concerned about coming in and it may be getting, quote, unnecessary additional studies just to figure out if they have cancer. And in fact, with the 3D, we can sometimes determine without getting additional pictures that everything is actually fine and there's nothing there. So this has been an amazing advancement in mammographic screening to improve both the sensitivity, what we call the specificity, reduce the false positive cases.
If we could talk a little bit about people not even having insurance, maybe to have this coverage. So Nancy Brinker, how is your fund, your Promise Fund, helping for those who just cannot afford it or just don't have insurance?
Right. Well, we, Tania, we really put this model together where that's why we're working with the federally qualified healthcare centers. A lot of people don't know they're even in their communities, but we have some very good ones here. Found Care is the one we work with, and we were able to get them a 3D hologic mammograph installation in the clinic. So, and they are very effective tools, very, very effective. So we work with patient navigators who must be from the communities where we know most of the high-risk patients dwell. And they have to educate them, bring them in, or they just come on their own, and we make sure that every woman, it's subsidized mammography, we take care of the cost. And it's a very effective way. Of course, the issue is, it's great, and if you find it, then what do you do with it? And the big problem in Palm Beach County is the screening, and also the treatment opportunities are very few for uninsured patients or those with very little Medicaid. So that's a challenge.
Thank you. The age that is advised for you to get a mammogram is at age 40?
Well, it definitely, I know the physicians will may have another point of view, but I couldn't agree more. The biggest problem we have with the aging of this is the United States Prevention Task Force Committee, which every 2 years, whether we want them to or not, get into a mammography dispute. They think that we should have less mammography than more sometimes because they say it creates false positives. I couldn't disagree with them more. They're a group of epidemiologists who were appointed in the days of Ronald Reagan, who were really looking to qualify equipment and to make sure screening wasn't overused. But it's the best kind of detection that a patient could have. So if they would just stop doing questioning it every 5 minutes, we would be able to use this technology even more without spending more money and perfecting it even more. It's what's fair to the patient.
Dr. Georgian-Smith, what's your advice as far as the age that women should start having a mammogram done?
Yeah, it's very clear in the radiology literature which spans worldwide. So we also use data from other countries to show the mortality benefit starting at 40. The reason why we actually don't start screening earlier is because we don't have studies that have really delved into the general population for screening earlier. But it is absolutely clear that it should be on an annual basis, starting at the age of 40, and their mortality benefits. That the benefit from mammographic screening is in addition to the improved treatment that have developed, now versus 20 years ago. So it's an additional benefit beyond just the improvement in the treatment.
And Dr. Berrocal, your comments?
Yeah, I agree. I think there's been a lot of question as to when do you start, when do you end, starting way back. I remember this first debate that I remember was early in 2009 when it came out that it could be 50 and you can consider every other year. I kind of stand by the American Society of Breast Surgeon guideline. For the average risk woman, a woman whose lifetime risk is anywhere from 12 to 13%, those women should start annual 3D screening mammography at the age of 40. That being said, with breast cancer treatment in 2021, we tailored the treatment to each individual patient. So I think you also need to look at that individual patient, assess their risk factors, determine, are these patients that are at a higher risk than average? And if they are, screen them with a screening plan that's appropriate for their level of risk, given their personal history. The date of last mammogram, that's also a very contentious point. The American Society of Breast Surgeons says if the anticipated lifespan of that particular person is less than 10 years, you can consider stopping screening mammography. The trouble part is I don't have that crystal ball. I don't know what that lifespan is on that patient. So, I don't have a particular age cutoff. I talk to my patients individually and we kind of assess what the best screening protocol is for them as they advance in age.
And can we briefly talk about metastatic breast cancer? We hear that a lot. I've heard that a lot the past year. What is it? People are like, is it a different kind of breast cancer? Is it what is metastatic breast cancer?
Sure. So metastatic breast cancer, it's also stage 4 breast cancer. And that just means that the tumor has progressed from the breast and lymph nodes in the underarm to some other location in the body outside of the breast and underarm. And that could be the liver, the brain, the bone, the lung. Once it reaches that point, we call it metastatic breast cancer.
And we have made some great gains in that. There are several new therapies that are being used. I think we're learning all the time about genetic, causes and so forth. And the fact is, when we were talking about the incidence of breast cancer and the death rate, actually, it's very high in women of color. Black women often develop it, and it's more fatal later. It's detected later, as do Hispanic women detect theirs. I think the last numbers I saw were the latest. They're sometimes to the detection, but also have lower survival rates. So it's very important, as the physicians have pointed out, to have a regular schedule. A patient always does better if she has a relationship with a primary physician who watches her general health over a period of time.
What's your comment on if you've had several mammograms that were fine, they came out great, is it okay to skip a year?
Well, I would say no. The point is, the cancers grow at different rates. Some are more aggressive than others. And if one were to develop cancer, you don't want too long of an interval in 1 year and the next, because you want to catch it before it has spread out. Again, as Julian said, I don't have a crystal ball, nor do I. I can't predict which woman might actually develop breast cancer in the future. That would be great, but we don't know yet. Of course, we try to do that with risk factors, as Dr. Berrocal has already alluded to. But that's the issue, is that if one were to develop a very you don't want to wait perhaps 2 years or longer to go from, one test or one imaging to the next. And so you're trying to catch it while it's still within the breast as best as possible.
And it's also so important, Tania, the cost factor. It's very much more expensive for a patient, and the physician isn't exactly happy with it either, because it's so much more expensive to treat a patient who progresses to a late stage disease rather than to have had a prevention technique or preventative strategy of having mammography. And maybe they even see, I guess they're called BI-RAD zeros. Many of the patients that we've screened at our center had BI-RAD zeros, which meant they had to come back. Maybe they saw a little something and then they know they have to come back the next year, or sometime maybe even 6 months later, to make sure that lesion isn't growing. Under Dr. Smith's evaluation, that's exactly what happens. This can change very quickly.
And Dr. Berrocal, your comments?
Yeah, you don't want to delay. I agree with the comments that have been made already. If you're being followed for something, there's obviously some concern, and they want to make sure the physician that's treating that patient wants to be sure that nothing's progressed or changed in that 6-month period. And again, in a year, there can be changes in the breast. I do know that for example, 2020, there were people who did not undergo their screening mammogram just for other reasons. I strongly encourage them to go now. I think it's safe, and it's an easy test to get that, again, when picked up early, if diagnosed with cancer, they can do very well.
Before we wrap up, I wanted to know if you guys have any final thoughts. Nancy Brinker, do you have some final thoughts before we wrap up?
Well, I'm always glad to see breast cancer awareness. I'm happy and sad to see it come every year. I'm happier when I get to see the numbers going up. But at the end of the day, we still have 250,000 women are being diagnosed every year, and maybe even more now in the United States alone. And it makes me sad because so many of them are not getting treatment early enough, and how important it is to follow what we're trying to tell people today, and especially the physicians. Pay attention to it. Don't skip your screening. The best chance you have with this disease is to catch it early.
Right.
Dr. Georgian-Smith, do you have any final thoughts?
Yeah, one thing I wanted to touch upon here has to do with the self-examination, palpable findings. The clinical exam, as Dr. Berrocal will attest to, of the breast is daunting because the way. And so women, when I'm scanning, they're doing an ultrasound and talking with them, they're afraid sometimes to examine themselves. They don't know for. They're kind of confused what that all means. And so it is, my recommendation is that every woman kind of get to a routine. If they're still having menstrual cycles, perhaps in the first menstrual cycles, if they don't have menstrual cycles, the day that they have to start taking of that month, something to remind that in the shower, in the bathroom, they should start, they could do a regular examination, that if any area feels different to them, they bring it to the attention of their doctor immediately. So even though we have these wonderful imaging tools of mammography, we're now doing more ultrasound screening, breast eye screening, when all of those are appropriate, there are still, unfortunately, a small number of breast cancer that is picked up by just clinical exam. And a woman will get to know what it feels like well before so I just highly encourage to continue to do self-examination.
Dr. Berrocal, final thoughts?
Yeah, just kind of concluding with our theme here, early detection is key. If you haven't done so already, go out there and get your screening mammogram. When you find out it's totally clean, you have a reason to celebrate. And if by chance you fall into that category where they find something, if it's caught super early, you can do very, very well. So go and get your screening mammogram.
All right. Thank you so much. Thank you to all of you for being here today. And We got the rest of the month, right? To raise awareness of breast cancer, don't we?
Indeed. Lots of pink.
Yeah, that's right. Lots of pink. All right. Thank you so much to all of you guests. Thanks for joining us
Thank
today.
you.
Thank you.
Thank you, Tanya.
Thanks for having us.